There's a lot of dental phobia out there that we can overcome just by getting patients comfortable. So sometimes it's simple things like the little nuances that we do with the TV and the blanket and the headphones and stuff, but sometimes you need a little bit more. So we offer free nitrous to any patient that wants it just to relax them. We also couple that with oral meds a lot. We go all the way up to oral conscious sedation. So we can get a lot of work done at one time, and the next day I call my patients and none of them remember. For more extensive surgeries, we go all the way up to IV sedation. So some of the larger procedures, by doing IV, we can also make sure they don't remember the experience, but also couple that with pain meds and steroids so that we can make the whole recovery experience a much smoother experience. And most importantly, get people to come in that are otherwise just out there waiting because they're so scared, so nervous, and I totally get it. The first visit's always free just to come in and talk and see what your needs are and understand what part of the experience makes you uncomfortable so that we can fix that and address that. We always go through your med history. There are some patients that are not great candidates, but it's few and far between. Most of the time, based on your health history, you're able to handle the oral meds that we provide so that we don't put you at risk. It's a very safe procedure. With special needs and autistic children or adults, we see quite a few. We see, I would say, 50 to 100 patients in that category every year, and part of it is just knowing what they like and what they don't like, whether it's the lighting in the room, to blocking out the sounds that trigger them, to being a little bit more conscious of when they're in the chair and just understanding what they need. With kids, sometimes they'll come in here 3 or 4 times before they let us lean them back and take a look at their mouth, and that's fine. That's just the way it is. And to get fillings done on them at a young age, we don't want that experience to come off traumatic. So whatever we could do to make that less traumatic for the kid, it makes the next appointment that much easier. So most of the kids that we're using nitrous on, eventually they're not even going to need it because it's a trust factor. It takes a minute to connect at that level so that they trust us, and once you get past that, a lot of times you don't even need those sedation options.